All right, so I'm Rae Petrucha. I'm a family doctor in Saskatoon, and I work out of Westwinds Primary Health Center, which is the site for our academic family medicine program, where we teach family medicine residents in Saskatoon. My project is looking at improving access to care for vulnerable older adult patients residing in personal care homes. And a little bit of the background for this project was that when I first started looking at it, I have 6 personal care homes that I have been rounding at since I started practice about 6.5 years ago. The patients who live in these homes tend to be quite elderly, very frail, unable to come into clinic for assessment or management. And so I was looking at a way to streamline some of the communication between patients, the caregivers in the personal care homes, and their families with myself and the clinic, because it was a bit of a disaster when we started. So my aim statement was that by April of 2020, all communication regarding personal care home patients will receive a response from the clinic on the same day. My initial driver diagram, I did not have the right questions asked. And then after our workshop session with Brandon, it clarified very nicely. And so this was the area that we actually looked at making adjustments with. So for implementation, what we ended up doing was we co-created a modified SBAR communication tool with the RN in our clinic, as well as several of the care home staff and myself. And then again, with our nurse Bethany, we modified the clinic process for phone calls received regarding these patients to streamline it within the clinic. So our first PDSA cycle was done in February 3rd of 2020, where we had the SBAR tool ready to go. We started using it, as well as a new clinic process for triaging the phone calls. And immediately I stopped getting phone calls and texts regarding these patients to my personal cell phone, which was amazing. And we stopped getting pharmacy receiving those phone calls within about 2 weeks, which they were very happy about. The second PDSA cycle that we started was done on October 5th of last year, and that was to increase the involvement of the family medicine residents in care for these patients to improve continuity. So some initial results. When we first started the project, about 59% of contact was actually going to the clinic instead of to my personal cell phone. And when we started using the SBAR tool in the new clinic process, it immediately went to 100%, which was fantastic. The community pharmacy was really happy because after 2 weeks, they stopped getting those phone calls, and then they didn't have to be a middleman. And I received a lot of positive feedback from patients, their families, and the caregivers at the care home about the involvement of the family medicine residents, which is also nice. The big things that I learned and reflected on during this project are that we needed to do more training and supporting of the care home staff in using that communication tool that we generated with them. There's almost always another level to go down to when working to identify the real processes causing problems. So like just continually asking why, and then running with the answer that you get, even if it's not what you expect. And then also realizing how many other areas there are for quality improvement work in this patient population that's possible, so that hopefully this type of work is more manageable for community physicians.